We'd like to welcome you to Research Day here on Bradenton campus, where the students will have an experience in interprofessional education where they learn with, about, and from each other. In 1988, Mill Creek Community Hospital, which is located in Erie, Pennsylvania, recognized that there was a need for health educators in the northwest part of Pennsylvania. So they decided to open a school of osteopathic medicine. In 1993, the charter class for the Lake Erie College of Osteopathic Medicine matriculated in Erie, Pennsylvania. Recognizing that there was a need for pharmacy healthcare in that area, they also opened up a school of pharmacy in 2002. Those schools were very successful, and in 2004, they recognized that there was also a need for healthcare providers in the Florida area, especially Bradenton, Manatee area. So in 2004, they opened up a College of Osteopathic Medicine, which is a branch of the Lake Erie College of Osteopathic Medicine in Erie, Pennsylvania. And then in 2007, they opened up a School of Pharmacy, which also has a distant education program. And that the School of Pharmacy at Bradenton is a 4-year program, and then their distant education program is a program where students do not have to be on campus all of the time. They can do some of it online. In 2014, we opened up a School of Dental Medicine, and we'll have our first graduating class in 2016. And now the dental school is housed at a building with architecture very similar to this, just north of this building. It also has a state-of-the-art clinical area where patients are seen by third-year students, and they also have a denture clinic there. In addition, the Bradenton campus also has 2 master's programs. They have a master's in health science administration. That's for someone who is in the healthcare field who has aspirations to become an administrator. This year, actually, in June, we're starting a master's of science program, and that is to prepare students to become physicians, pharmacists, or dentists.
My name is Kirsten Schroeder. I've been at LECOM for 4 years, and my position is Assistant Professor of Biochemistry. And as today, I'm here in capacity of Chair of the Research Committee, and we're showcasing the students and the research that they're doing in the community. We have excellent students here. They do top-notch work, and we want them to be able to learn from each other and be able to interact with each other in a way that helps with the interprofessionalism when they not only here on campus, but when they get out into the community, working together with the physicians, the pharmacists, dentists, and the local communities that they're going to work at. So today you're going to see different aspects of the programs that we have. So you'll see posters from the medical students, where the medical students will be talking about different types of research that they've done, case studies, talking about computational research that they've done, research that they've done out in the community on their 3rd and 4th year rotations, research that students have done in the anatomy lab. And then we'll look at pharmacy students programs where most of them have been doing computational research, a couple of them, and then one of them that's been working in conjunction at Blake Hospital, for instance, and working with a team of trauma surgeons out there. And then with the pharmacy school, they have their poster day where their students are going through and talking about the different types of medications and how they relate to diseases, and trying to put a perspective on why they're learning these different drugs and being able to help other students be able to get a better understanding about the drugs that they will be dispensing. And with the dental students will be talking about research that they've been doing in their 1st, 2nd, and 3rd year for a lot of them, and trying to make a difference and make people's lives better when they come to the dental office, because as you know, as most people talk about, they hate going to the dentist, and if they're not coming here because they're not getting treatment from our students, but we want it to make a pleasurable experience for them. So the research that they've been doing is to be able to help with that. So this morning I've already walked around, probably talked to a few dozen, maybe even more than that, students. They seem very excited. They want to tell you about the research that they've done. They want to tell you about the information that they've learned, and they're excited about getting the information out to people, and anybody that wants to listen and learn from them. It makes them feel good that they're valued and that they are doing something that's going to help with patients in the future. And that's the reason that we have the interdisciplinary day, is to put the pharmacy students, the medical students, and the dental students in the same arena, being able to talk about research in a professional manner and being able to explain it to different disciplines, because each group has a different background and their lectures are different in the pharmacy and the dental school, and in the dental school and the medical school and the dental school, they learn their basic sciences through problem-based learning. So they're trying to be able to teach that, and that's what research is having a question and then being able to answer that question and then teach that to somebody and make it so it's helpful for them in their future. I believe that the problem-based learning is successful, specifically in the medical school and in the dental school. The two programs that use it the most is the fact that the students are taking ownership of their learning. They're going and they're asking a question and they're going to find that answer for themselves, not relying on a professor to say, hey, this is the answer, and then they're not going to go looking up. It teaches them to question everything. And as a healthcare provider, you have to question everything, because how if you're wrong? And so you have to be able to say, okay, what's the next step if I'm wrong? Where would I go here? Where would I go there? Here they're learning the basic sciences and applying it to clinical cases. And I think that's something that's key, because we're also making it a little bit fun and making it related to something that they're going to be doing out in the community. So we want the students to be able to see the healthcare providers working together, and administrators as well at the local hospitals, so that they understand what it takes as a team aspect in someone's health, especially in this community. For instance, today they'll be talking about a geriatrics case, and if you've lived in Bradenton long enough, you know that there's a couple of people that would fall into that category. Some would like not to admit that, but they would. And I think that they get to see how that would play and how that would work for them when they get out into the community. For instance, that would be something that, especially if they go back and they practice here, they have to do on a regular basis. And if they don't know how to do it, it's very difficult for some people to learn that on the job. So here we're given an opportunity to see how that could work for them. So I'd like the students to take away having a newfound respect for all the other disciplines that are also being taught here, because they don't interact as much as you would think they would, because they're in their own classes, they're in their own study groups, and here this is hopefully to be able to bring them together, to be able to show that, hey, if I don't have the information, it doesn't hurt if I go to a dental student or to a pharmacy student, or if it's a pharmacy student to a medical or a dental student, to be able to talk about what they might see in the future and how they're approaching those same basic science questions and how they would look at it, because each group has their own take and how they are going to get that kind of information, and something that at the end of the day they should be able to say, this makes sense, this is why I'm doing this, and hopefully be able to go out and do a great job in communicating that information, not only with the other healthcare providers but also with their patients. And that's something that a lot of patients out in the community would absolutely love, to be able to know that their healthcare providers know how to communicate effectively, not only with them but also with other healthcare providers in the area.
I'm Julie Wilkinson. I'm the Associate Dean for the Pharmacy School here on the Bradenton campus of LECOM. I've been here for 9 years, since the Pharmacy School started. We have 570 students. It's a 4-year program, so we enroll 143 students per class at the Florida campus, and we also enroll 24 students in our online distance education program for the Pharmacy School. Well, LECOM, we train medical, pharmacy, and dental students, and everybody's focus is on improving patient care, improving the lives of our individual patients. So this is a time when everybody can come together, learn together, focus on what our real goal is, and learn from each other, see what the other disciplines are learning. Most of the time we're pretty isolated. Our schedules are tight. We have a very structured curriculum for each of the programs that's very well coordinated by our accrediting bodies. But in recent years, all of those accrediting groups have recognized the importance of teamwork, and that in the medical field we have to work together, and they have actually insisted that all the schools train the students in a manner where they learn together. Sure, the pharmacy students have this as part of a required course. So our third year students have all been working all year on projects where they're in groups and they're researching clinically relevant clinical questions, doing research in the medical literature to answer a question about drug therapy. And today they're presenting those posters, and their audience is going to be pharmacists from the community who are coming in to judge their work, as well as faculty from all the disciplines and the other students from around campus. So they're nervous, but they're excited, and they see this as an important part of their education. Well, I think that a big part of what they're going to get out of it is they're going to be shoulder to shoulder with the other students on the campus, and they're going to see themselves as these budding healthcare providers who are really focused on the end goal and why they started here in the first place. And so I like to see us coming together across the campus. The faculty are going to be modeling that. They're going to be attending that presentation, and they're going to be walking around to the posters. So it's all of us coming together as one school. Well, thank you. I think that we're excited about what we're doing here, and we have faculty who are truly committed to student success. You're here on Research Day, but really every day is about teaching. That's our primary goal. We're here for our students. We care for our students, and we're committed to their success. So I would like the community to understand that the reason LECOM's here is to make health professions education more accessible to all sorts of people who have worked hard and put forth the effort to get here and have that commitment to patient care and professionalism. We have faculty who try to model that day by day and grow in their own professionalism and scholarly work and in their quality of their teaching, and that we have a good community that works together for those goals.
Hello, my name is Alex Vasquez. I'm a PharmD here at LECOM. I've been working here for almost 6 years in July, and I am in charge of all of the posters being presented here for the pharmacy school. I took over this position when I first got hired, and I've been doing it ever since. This is a required course for our third year pharmacy students. Every year in the spring they get together in groups of 6 and they work on a large research project together. Most of the research here is actually a review of the literature that's already existent. Most of it's not original research, it's actually culmination of a lot of data into a poster presentation that hopes to help change the range of practice for a lot of these issues. It is required, as I said before. The students are third year students. They're actually just about to go on their fourth year rotations for their clinical studies. So we have a group here, a poster group here, and I will go ahead and introduce them. So why don't you go ahead and say your names first?
Hi, I'm David.
I'm Lana.
And my name is Duke Trong.
So this is a poster here. I guess we can show it there. Okay. And why don't you tell us a little bit about your poster?
Sure. What we did is we did some research looking at the efficacy of a fecal microbiota transplant for patients with recurrent C. diff or Clostridium difficile infection, and we found that within many studies that the current standard of treatment, which would be antibiotic treatment, is not as effective as what we're currently studying, and we found that patients who are given a fecal microbiota transplant take to the effect really well.
Okay, so a fecal microbiota transplant, that may be a little technical for TV, so what exactly is that?
Oh, it's when, let's say if a patient has like really bad recurrent C. diff diarrhea. So this is like a new procedure where there's different methods of putting like a donor's feces into the patient's body. So there are different routes of doing it. They could do it by enema, or they could do it by colonoscopy or nasogastric route.
So it's a procedure that is a little unorthodox. It's not a pill that you would normally think about, right? So what did your study find, or what did your research find about this procedure?
Our research find that this treatment is very effective in a lot of patients. It is more cost effective. It eliminates a lot of adverse effects with traditional antibiotics treatments. And within short period of time, people get a lot better. And what we are doing presenting today is that we're trying to argue that, why don't we start this treatment a little bit earlier versus so much later, further down the line. And we hope that the FDA will somehow regulate this, and push that, onto the guidelines, as one of the first treatments.
So that's just an example of one of the posters that we have here in our session. As I said, it's an annual event. The posters range from stomach problems to bleeding disorders to care in uninsured and to low-income patients and anywhere in between. So this is a semester-long project, and in their groups of 6, they do an extensive literary research search online where they search public journals and private journals that we subscribe to here at LECOM and gather as much information as they can that's out there. So they're instructed to really do an extensive search and try to find everything related to their topic. That way they can have a complete review of all of the information available.
This is one of the best experiences that we've ever done together.
So generally, it's a little difficult in the beginning. Group work almost always is, but once they end up working together and once it culminates in the posters, most of them end up walking away, I think, with a positive experience. So as pharmacy students, we focus a lot on being able to take data and convert it into a change in practice and take information that's out there and use it for real people. So we spend really their entire time while they're in school, they spend it learning about drug information, how to read and interpret data. And this poster presentation is a culmination of all of that. So hopefully when they leave and they go out into their clinicals and eventually they become real pharmacists, they are still able to read this information, continue learning about new and exciting ideas and processes, and hopefully apply them to their patients while they're out there.
Our poster's advisor is Dr. Mike Hardy-Smith. Unfortunately, he is not with us today. He dedicated a lot of time and effort in nurturing us and help us get better. And this was his amazing idea, and under his guidance that we came up with this amazing topic. So we would like to dedicate this poster to him as a group collectively, and we're very thankful for the opportunity.
My name is Zachery Loud. I'm a third-year medical student here at LECOM in Bradenton. I'm from Eden, Utah, small town Utah. And this is my project. It's a case report of a patient that I met while on a third-year psychiatric rotation. This is a patient that I met, as I said, is a psychiatric rotation, a 63-year-old male who presented displaying symptoms of dissociative fugue, or in other terms, amnesia with travel, the two together. So found traveling, found in the middle of the woods by his car, out of gas, and no idea who he was or where he was going or why he was going anywhere. So in the unit, we treated him, discovered some key important facts about him, established his identity, and got him back to the medications that he was on before, and he returned back to baseline, just oriented to self well, and is back out in the community, living his life as normal.
Okay, I'm Dr. Moretsky, and I do a lot of research with a student. Zach's interest was to follow up some kind of research in behavior science or psychiatry, and this was very interesting case for the third-year medical student, to do the research and also show his interest of pursuing the psychiatry residency in future. And I think he did a great job in identifying the case, identifying the outstanding case, so it could be a lesson for other medical students to how to conduct the research, how to do the case report, and a presentation. I think this is a good pathway for the third, fourth-year medical student to interest, to show their interest, what kind of residency they are interested. In this case, is a behavioral, case, very classical finding And I think Zach did a great job in identifying such a patient and making a great case report.
The big things that I took away, the key points that I wanted to bring up with this, first, just how to do the research project in the first place, learning the process, learning the entire procedure that we go through. The points from the procedure and from the actual case that I liked was just the need for working with patients, especially in mentally ill populations, need for working with patients and their families, developing a relationship, a working relationship, to figure out how to best help them. In this case, it would have been impossible to do much for this patient without discovering that he had a niece that was his caregiver, and we were able to receive a lot of collateral information to help identify him as a person and how best to work with him. Well, my experience has been great. Honestly, I've been very happy here. I think Florida is a great location to be, and I think LECOM has done a lot for me as far as allowing me to do that. I've wanted to go into psychiatry for the last over a decade, and this has been a really good step, and it's allowed me to do that. LECOM's given me what I need in order to make that happen. Okay. Well, I am a second lieutenant in the U.S. Army. I work for the medical department. Upon graduation, I'll go active duty as in be upgraded to captain, promoted to captain, and enter residency at a military hospital. For me, it will either be at Walter Reed in Washington, D.C. or Tripler in Hawaii, as those are the only two locations for psychiatric training that the Army currently offers. It's important to me to serve a country. I'm a third generation in the military. My grandpa served in Vietnam. He was a paratrooper, and he did a lot of rescue missions, a lot of medical stuff. He actually was a medic as well, this paratrooper. My dad was an air evac pilot in the Gulf War, and I just kind of always felt that this was my chance to do it. And this is the way that I can contribute to that legacy that we have going on.
My name is Jason Hudgins. I'm a first-year medical student here. I am also an X-ray tech at Florida Hospital Apopka, and I'm from Orlando, Florida. This is actually where I took this picture here. We had this case come into the emergency room, and with very similar symptoms that we would expect to see in the case that I'm presenting right here in my poster, where this poor, unfortunate person actually came in with a gunshot wound to the head, where when they came to our emergency room, they were already intubated, so their respiratory system was already compromised. They were in a coma, so their reticular formation in the midbrain was also compromised. And sadly, this person did not make it, but it still gave a very good opportunity to teach fellow medical students about what could happen here. As a medical student, I think this is a perfect opportunity here. Research is a big part of being a doctor. So to have an opportunity to show what we learned to all of our fellow students and also learn from other fellow students is great.
We're here with another pharmacy group that worked on a poster regarding weight loss. So why don't you go ahead and tell us a little bit about your poster?
Okay, what we did, we look at the map, and we got 39% of the world's population is considered overweight, and about 13% of it is considered obese. And the United States has fallen into the highest prevalence category, with 60% of the population is considered overweight. And this part right here is about 30% of the population is considered obese. And as you can see, overweight and obese individually have a higher risk of cardiac disease, strokes, diabetes too, and also a certain type of cancer as well.
Weight loss is a very interesting topic to us, and like Dennis mentioned, a lot of people is overweight and obesity, and some of the conventional treatment is often difficult for the patient to do it. So, and they need additional intervention. So what we did is we compare 4 new drugs treatment to standard treatment. So we have leucocerine, phentermine, topiramate, liraglutide, naltrexone in a combination with bupropion, orlistat, and phentermine. So if you look at the table 1, these are the results that we get from our when we did the research. And then we take those results and we plot a graph to compare the average weight loss for this study. So on the graph, it shows 5%, 10%, and 50% of different drugs. And in the figure 5, it shows the average weight loss for each drug. And you can see that the Q-Semia has the highest average weight loss. And in the figure 6, it shows that the rate of the discontinuation of different drugs due to the adverse event, and contrary has the highest rate of discontinuation.
So a lot of drugs, a lot of numbers. This is very involved research. Why don't you go ahead and just summarize kind of for everybody at home that doesn't know all of these drugs, what you all found.
Okay. All right, so what we really found is that if you need to be on weight loss medications, then you always need to start with diet and exercise. And you have to actually be overweight and need to lose a bit of weight, a significant amount of weight. You can't just want to lose 5 to 10 pounds to start these. So you do need to, do the diet and exercise and need to lose weight. And then what we had found is that the phentermine, our top line on the graph in the middle, that one is only FDA approved for short-term treatment for 12 weeks or less. So that is a really great drug for short-term treatment. But what you have to watch out for there is older patients, because it is actually on the Beers list, and you have to watch out for patients that have cardiovascular issues like hypertension. Then this wouldn't be the best drug for them. And then the Q-Semia is the best long-term drug that we had. So that's a combination of the phentermine and the topiramate, and that one had the highest amount of the average weight loss out of our medications. And some of the adverse effects were kind of high on that one. So there were several people that did quit the trial because they were having the tingly, numb feeling in their fingertips. And with topiramate, you can have a little bit of cognitive dulling. So some of the side effects were not the best, but overall it was a great medication. So all of the medications would help with weight loss, and what we really found is that it's very patient-specific, and the patient, what medications they're already on is going to affect really, which medication they should take.
So the research is very high quality. It's an extensive search of the literature that exists. So although it is not original research that the students are doing, it is a gathering of existing data, and it is pooling it all into a 1 or 2 cognitive statements. And the students have to do it for a grade, so they definitely take it seriously. But they also tend to take it with them when they go on rotations. They present it at national organizations or national organizational meetings. There are a number of Florida and national pharmacy meetings that students will go to and present their research to pharmacists from around the world.
My name's Dr. Todd Nolan. I'm an assistant professor of physiology here at LECOM Bradenton in the College of Medicine, and I'm here at Research Day to learn a little bit more about an anatomic anomaly in kidneys from Tara. Well, Tara has a very interesting project, and I think it would be much better if she did some of the explanation about the supernumerary renal vasculature.
So with this, we were doing just a random dissection for anatomy, and during this time, one of the doctors found some sort of abnormalities with the kidney. What we then did is did a block dissection to localize everything, and we found that there was all sorts of vascular anomalies present. So we did various dissections to see if it was complete duplications, things like that. We also did histological staining to see if this was actually functional, and the histological staining said that it was in fact functional cortical tissue. So really the interesting part about this case is we've yet to find anything in the literature that has both variations in vasculature plus the double ureters. So looking over here, it almost looks like somewhat of a hybrid between what you would call a duplex kidney, which is one kidney that is fused and can have 2 ureters or 1, and a supernumerary kidney, which has 2 separate encapsulated kidneys, and that one typically has vasculature variations. So the interesting part about this case was we haven't really found anything similar to this, and it appears to be almost a hybrid between these two. So it was just very interesting that we were able to find this just doing a routine dissection for anatomy class. So initially all the dissections were done by our Dr. Snelikoff, and he introduced to me that there was something abnormal with the kidney. So I was helping with dissections. We dissected it all out, and then bringing up this, it was very confusing for us. We hadn't seen anything like this. So I worked with Dr. Liuzzi and Dr. Rosenthal and also my partner Huey, and we tried to figure out what was going on here. And with that, we were able to do a lot of research, gather a lot of data from other anomalies. And it was nice because then we could also have some sort of clinical application to it. And the importance with that would be to understand that renal anomalies can occur in about 1% of live births. Not specifically this one, of course, because this one we haven't found yet. But there's very importance in terms of if you have double ureters or multiplications in the arteries, these are end arteries. So if during surgical procedures, one was to be ligated, that whole function of the kidney, it wouldn't get its blood supply. So it's important to do imaging beforehand to look for any sort of duplications or things like that. Same thing for transplantations. It's very important before any sort of kidney transplantation to do the correct imaging to see if there is any sort of variations.
I think this is a very interesting project. Has a lot of implications surgically. Definitely helps emphasize the importance of proper imaging before you go in to do anything. It emphasizes that anatomy isn't static. It's a very dynamic field and has a lot of applications clinically.
So one thing that was very interesting is I have a history of doing dissections, and typically you're doing the dissection, you're just thinking about what you're doing. This kind of came to mind, the fact that there's so many variations between individuals and individuals. And so something as simple as doing a dissection for an anatomy course, where we're trying to learn generalized anatomy, you can come up with some incredible variations that, you know, he might have gone his whole life without having any idea of. And so being able to kind of discover something so rare in a setting where we were simply just trying to dissect was really interesting. And being able to work with the faculty and everything very closely on this, and all sorts of resources we had, being able to get the staining and everything. So it was very interesting that all this came about just from a simple dissection.
So my case report is on primary torsion and infarction of the greater omentum. It was a case that presented as acute appendicitis. It took, I worked with one of the surgeons that I was working with in third year. We did the procedure. We talked about it after we did the operation. And it was an interesting case that the surgeon that I was working with hadn't seen. So he wanted me to write it up, and it took about, I'd say, a month to a month and a half to finish it all up, doing the research on it and finalizing the details.
Tell us a little bit about what went into doing your research, and what kind of study did you put into it, what kind of details that you have to gather?
So what I did was a basic literature research. The LECOM library does a pretty good job of getting articles if we need them. So the main thing was, I worked with the library and they got me access to some of the LECOM articles, and so that was the majority of what we did. Got about 13, 14, 15 articles, and processed through them, and saw what the literature actually said on this particular case, and then just used what I thought was relevant for this case. So the facilities are great. The teachers here, try their best, and the clinical faculty does a great job of introducing us to what we're going to be experiencing on the wards. Giving us Dr. Hummel and Dr. Schoeffel did a great job, prepping us for what we're going to be experiencing when you do your physical exams, and how to take a history, and generally introducing us to those aspects. So I thought that I was very well prepared going into the wards. making this diagnosis aware for someone, for a condition that can be treated conservatively. Something that people should know is that you can treat omental infarction conservatively, and so that's the biggest thing.
Yep. So my name is Douglas Robinson. I'm from New Haven, Connecticut, and I'm a second-year dental student at LECOM. And I did a research project with some of my classmates, Nathan Estrin and Dylan Tagg, about the bifurcation of the inferior alveolar nerve. It is the major nerve in the mandible that innervates all of your lower teeth. And in some people, instead of having one canal, it actually forks into two. And this is interesting because anytime that you're trying to get any anesthesia on those teeth, anytime that you're doing surgery, you want to be aware of where those nerves are so that the procedure goes well as planned. And what we looked at was cone beam analysis. So cone beam allows us to 3D image the mandible. It's something that was not available in the past. In the past, you could just take a flat x-ray. And in those x-rays, you couldn't see the anatomy like we can see it now with those 3D models. And we're finding that the fork occurs in that nerve much more often than we believed in the past. Instead of 1% or less, now we think it's in the double digits, anywhere from 10%, 15%, even up to 65% in some studies. So it's much higher. It's a new area of research, and we just thought it would be a good place to add some more data since there is such a broad range. Yeah, absolutely. So what we did is we acquired 125 scans from a private periodontal practice in the Orlando, Florida area. From those 125 scans, we were able to use 116 of them due to their diagnostic value. And basically what we did is we started from the front of the jaw. You actually have a hole in the mandible called the mental foramen. We started there so that we knew that we were dealing with the nerve in question, and then followed it back. In the computer, you could in essence crawl through the nerve canal and know exactly what you were dealing with, and just looked for any instances where it forked. And then from there, we did do some measurements about proximity to nearest root tips and proximity of the canals to one another. In addition, we did a lot of research in data that's already out there in previous studies. We wanted to know where we stood compared to everybody else. So we looked at recent cone beam analysis within the last 10 years or so, and then panoramic X-ray studies going back all the way through to around the 70s. So a combination of research and then just analyzing the scans ourselves, and we came up with this data. Yeah, absolutely. So to start off, our biggest conclusion so far has been that we agree with our hypothesis, which was that our findings were going to be in excess of what the data in the past showed. These cone beam studies have shown time and time again that the incidence of this bifurcation is higher than the panoramic studies. So we agreed with that. The other conclusion we came to is that we need more research. Our study is pretty small compared to the other ones, and a lot of our statistics were not quite significant yet. Some of them were very close, but close doesn't cut it. So we need more numbers to get more statistical strength. Working as a group was definitely a good scenario. You know, you learn how to work with others and also get more eyes looking at something. Some of these scans are not as straightforward as you would believe. You know, you might have a question about what's going on in one, and getting more eyes on it definitely helps shed light and help us get to a more accurate conclusion. So medicine is it's about the whole body. So in order to take care of people properly, you need to incorporate all of those different professions. Dentists take care of the head and neck and oral cavity, and that definitely has an impact on systemic health, but we can't be experts on everything. So we need to incorporate our colleagues in order to make sure that we're giving the patient the best possible quality of care. So previous to this, I had a little bit of research that I did in college, but I had never done anything as major as this or anything dental related. And one day I was talking to one of my faculty members, Dr. Louisa, about actually pursuing postdoctoral education, and she informed me that research would be something that could definitely help. I agreed with her, and within about a week or so I had met with Dr. Yoon, and we had a project going. So it was a very smooth transition. There's definitely a lot of opportunities out there for people, and it was a very welcoming, warm experience.
My name is Desiree McMillen. I'm from Fort Pierce, Florida, and I'm a third-year dental student at LECOM School of Dental Medicine. Okay, so the work that I'm presenting today, I did a survey on underserved populations. It's basically a parent's perception of pediatric oral health care, and I wanted to bring awareness to the fact that there is a lot of underserved children who have dental decay. The AAPD just released a statement that said 60% of children aged 5 will have caries by the time they enter kindergarten. So I thought that was a huge deal and something that I wanted to bring awareness to. Also, something else that is really important to note is that the AAPD recommends that parents stop assisting their children brush by the time they're 8 years old, and only one person out of 58 was doing that correctly, so 97.6% of the parents were stopping brushing their children's teeth at an age that was too early. So last year at the inaugural research fair at LECOM School of Dental Medicine, I won first place, and I was inducted into the SCADA Student Clinician Research Program. I was given the opportunity to present at the American Dental Association, where thousands of my future colleagues and fellow presenters were there. That award was really amazing. Each dental school is only allowed to send one representative, and I was the representative for LECOM. I was also asked to present at the Special Care Dentistry Association because the person that was there thought that my research was really important, so I was given that opportunity to go to Chicago and present there just last weekend. That actually my mother is a kindergarten teacher in St. Lucie County, and she teaches at an underserved school there, and so I had over 900 volunteer hours in the St. Lucie County School Board system, in which I was able to go to these kindergarten and first grade classrooms and see the amount of dental decay that these poor children were experiencing. And so it's not the children's fault. The children are 100% dependent on their parents' education and ability to teach them about their oral hygiene. And so I really think that this survey is important because we would like to be able to reach out to the different professionals, the teachers of Lamaze, the lactation specialists at the hospital, pediatricians, OBGYNs, and really explain to them the importance of their children's oral health care and get these parents educated before they get into the dental office. I would like them to take away that there's a disparity in the amount of education that underserved populations are getting versus the overserved. The children below the poverty line, 30% of them have untreated decay, whereas above the poverty line, only 6% of children have untreated dental decay. And so that's a significant difference. We really need to start reaching out to these populations that are already underserved and stop the dental decay disease from happening. We used a questionnaire. It was a 25-question survey. We passed it out at our Give Kids a Smile event, which is an annual event that LECOM puts on where we do free dentistry. This year we did over $75,000 worth of free dentistry in one day, so we were really proud of that. So we reached out to those parents and asked them if they would be willing to participate in this survey, and they all did, which was really exciting, and that's what we wanted to do. We wanted to just bring awareness to them. Yes, my partner, William Buse, he helped me out with this project, and we're really excited to continue this and maybe get a grant to start putting out this education material to the parents and their physicians and stuff that need it. Yeah, LECOM has been really instrumental in helping me get my research where it needs to go. I've gotten national recognition for some of the research that we've done. We're working on getting it published. The teachers and the faculty are nothing but supportive, and they help us out in any way they possibly can. This is an opportunity that I wouldn't trade for the world.
Okay, my name is Mark Goulding. I'm from Buffalo, New York. Our project is concerning vertical root fractures. What Chase and I and our other group member, Michael Hummel, wanted to do was give the patient an option for vertical root fractures, because what we learned was that the only treatment modality was extraction, which can't be the case because it seems like we need better options for the patient.
So we've been taught in school that essentially when a tooth is vertically fractured in the root, that you extract the tooth, which leaves the treatment options of implants or a FPD or a bridge. So we looked at other literature that's out there, and it showed that there are other treatment modalities that are being used. And so we kind of applied that information, and we came up with an idea, a treatment modality that would be cost-effective for a patient.
So when looking at the literature, we found that practitioners will bond fragments. Hello, Michael. Practitioners can bond fragments of the tooth outside the mouth and reimplant the tooth. This has a pretty good results. So what we want to do is be able to bond fragments of the tooth through the canal with an obturation material.
Well, there was a really interesting story. We were taking a class on endodontics, and there was a slide that said vertical root fractures, and then the next slide said treatment modalities, extraction. So we kind of got together after that and said, hey, you know, there has to be something we can do about these vertical root fractures and a way to fix them. So we kind of looked into the research, and we found that there are treatment modalities for it. And it involved a lot of material science. So at our school, Dr. Primus was kind of the expert in that field. So we went and talked to her, and then we kind of came up with the idea of applying MTA to these vertical root fractures, which has allowed us to come up with this idea of adding hyaluronic acid or other polymers to fix this and give a patient an option and a treatment modality that's within their means. Other treatment modalities can be very expensive. This saves the tooth. Hopefully, theoretically, it saves the tooth. And we're really excited about working more with Dr. Primus and, you know, finding a treatment modality that helps the patients with vertical root fractures.
We would meet with Dr. Primus and also Dr. Goodis, who is a retired endodontist who is also faculty here. We would meet with them at least once a week, and oftentimes we would actually go into Dr. Primus's lab and discuss further research plans with her there. And currently we are in the process of testing compressive strengths and tension strengths of the material we're using in Dr. Primus's lab. So it's been really great working with the faculty here. They've been really receptive, and they've been really helpful in our research endeavors.
We like people to take away that extraction isn't the only option for them, and this research could really help in saving the tooth and avoiding the use of an implant or 3-unit FPD.
Well, beyond just vertical root fractures, interdisciplinary trust within physicians, dentists, pharmacists, all other medical fields is important, because at the end of the day, the care of the patient is the most important thing to us. And in order to take care of our patient, we need input from every single member of the medical team. And the dentist's role is just as important as the physician's role, and it's just as important as the pharmacist's role. So it's very important that we all work together. And this project is a microcosm of that. You know, taking knowledge from Dr. Primus, Dr. Goodis, Dr. Louisa, our inquisitive ideas of how to treat this stuff and work together. It really shows that when you come together as a medical team, you can find results that help the patient.
Okay, I'm Dr. Howard Moretsky. I'm the director of the Simulation and Education in LECOM School of Dental Medicine, Lake Erie College of Osteopathic Medicine, School of Dental Medicine, and we are in the simulation laboratory. Okay, we have 50 plus simulators here, so the students in their first and second year are able to practice on a model patient and do everything they're going to be doing in the clinic side when they get to actual patients. They work on plastic teeth here, but they use every procedure that they will do in practice. This is a 2-year program. On the preclinical side, we have 50 students in the morning. We repeat it in the afternoon for the other 50 students, because in each class there are 100 students. And basically we deal with the first and second year dental students. The third and fourth year dental students actually work in individual clinics, and that is another part of the building. As you can see, the monitors on the desks. At the podium up front, we have all the audio visuals, so when we show the student what they're going to do that day, they're able to follow along with us on their monitors. And whenever we want to show them individual pictures of how procedures should be done, we put them up throughout the session, and they work on their patients. Now, I was told that this person is Frank. Hopefully that's the right name and I'm not insulting him. But they all have the mannequin, and they have teeth that actually are magnetized into the jaw so they can work as if they're working on an actual patient. And these teeth obviously are plastic, and this is their first introduction into restorative dentistry, crown and bridge, root canals, the whole gamut. So now they have a patient they can work on, and as they do the individual procedures, they get graded along the way, and we help them along the way if they need help. The grading takes place in the computer system. They actually have a record of this patient. This patient has an age, it has medical conditions that they have to deal with, and everything is in the Axiom system. That's the computerized record system. It's a state-of-the-art. Now, these dental units that they're working with are the same dental units that they will be working with in the clinic with patients, and probably better dental units, more modern dental units, that some of them may end up working with at least early in their career. They have, obviously, the air and water, which everybody knows. We have two different type of hand pieces, which I guess for the lay public, they're drills. One is electric-based and the other is air-based. The electric is the most current on the market. Air has been around for many years. Electric is newer. They have their suctions. And down in this area, if they're doing root canals, where the motors have to go at a much slower speed, they are able to control the speed of the motor down here. They could control it all along their procedures, but this area is basically for changing the speeds and putting it on root canal settings. The students are getting a first-rate education, state-of-the-art education, and the patient base is getting a real good exposure to good dentistry. In other words, when a patient comes here and gets accepted as a teaching case, they're getting thorough treatment. It's not that this tooth hurts, take care of this tooth. They're going to get a complete treatment. We do dentures, especially on homeless people at no charge. So the community is getting value out of it that way. And the treatment that's given to the paying patients, so to speak, is at a much reduced rate. And obviously it's a school situation, it's a learning situation. People have to be cognizant that it'll take more time to get the treatment done, but they're getting thorough treatment. It's checked off all along the way.
My name is James Houston, Assistant Professor of Restorative Dentistry, full-time preceptor. This is SDI Pod Clinic. I'm a full-time preceptor here. I have 10 students under my preview, and obviously we are mentoring them and teaching them. And what they really have are individual practices, and this is basically a group practice, and that's all we teach. So we are one-on-one instruction. So they progress from the didactic side to the clinical side, and we have to make that transformation for them and show them, make sure that we can reinforce what they have been taught and transfer, and at the same time, obviously, we're treating patients. Each student has a roster of patients to be seen, and they're normally scheduled 2 a day, 1 in the morning and 1 in the afternoon. So when they come in, we review their treatment plans and how we're going to proceed, and then we have to okay them to get started, and we monitor what they do and how they do to completion. This is one of the only schools where they are afforded this opportunity, where they have their own individual operatories to work out of, so their own little practice. And so they're gaining practice experience, group practice experience, as well as being educated. Well, normally the students are excited. They want to know how we do what we do, and then they get a chance to experience what they do, and they get to see the results at the same time. Quality of students is excellent, and like I said before, that they are so eager to learn, so it's easy to teach them. And by us teaching them one-on-one, they really gain a greater appreciation for the profession and how we do what we do. You know, I tell my students all the time that they're going to be spoiled when they leave here because this is state-of-the-art. But they get a chance to experience it. They have all of the latest equipment to work with and everything, so which makes learning a lot easier too. So for that transition, so when they leave here, they're already prepared for what they're going to experience when they graduate. Pretty much all of the new technology that's been coming to the market now is available here, which is a great thing. I worry sometimes about the students getting a false appreciation of what's really happening in the outside world in terms of what it costs. So I want them to understand their value, the value of what they're getting here, and what their expectation is here, and what it's going to be when they graduate. The community needs to know that that they can avail themselves to coming down here. They're going to get obviously expert treatment because all our preceptors and our faculty are already expert. Myself, I've got 40 years experience, and so I'm able to relate that immediately to my students. Obviously, we are overseeing what my students are doing, so they're going to get the best of care. Now, we can't treat everything. I've got third-year dental students. But anything we cannot do here, we can refer out to make sure they're taken care of. And in the year that I've been here, I've seen some evolution. I love this place. When I look at it and how we are evolving now and what's on the horizon, I get excited because I can see the future, where we are going. And our students, I feel, they are blessed to be here and have this experience now, especially now, and they're making history. And we're making history.